nurse, now living in Maryland, will soon be on her way back to Buffalo. She was arrested today, accused of stealing prescription medication from Sisters Hospital. 7 Eyewitness News reporter Ed Dranch tracking down this story for us tonight.
And Joanna, this nurse only worked at Sisters as a charity hospital for a matter of weeks, but in that time, prosecutors say she stole medication, and instead of giving it to her patients, she injected that medicine into her own body. This medication wasn't easy to come by either. The nurse had to jump through several hoops to get those narcotics, including a scan of the intended patient's hospital bracelet and her own fingerprint. Samadi was a nurse in the labor and delivery unit at Sisters Hospital between November of last year and January of this year. Now, when she would withdraw these medications, she would use them, but then cancel them out in the machine, saying she selected the wrong medication or the wrong patient. But it was clear, according to U.S. Attorney Bill Hochul, this was done several times.
Of the 80 remaining vials that were turned over for sampling and testing, 75 of the 80 had in fact been tampered with, and they were ready to go. And of those tampered with bottles, a percentage of them had only 10% of the effective drug remaining.
The hospital is owned by Catholic Health. A spokesman released a statement to me earlier today reading in part, quote, "The nurse under investigation was contracted to work on a per diem basis through an independent staffing agency. Her contract was terminated." Now, the nurse hasn't worked at the hospital since the alleged incident, according to that spokesman. But I've just learned this isn't the only hospital the nurse was fired from. I've learned she was also let go from Children's Hospital. I'm working to dig up new information. I'll have those new details tonight at 6. Ed Dranch, 7 Eyewitness News.